Kongoi mising eng inyendet ni tesetai igere Kass TV akot eng kasari noton nebo tetitenyo nebo kotab legityo kimiten kora ketesetai ak Dr. Catherine Mutisya ne inendet ko daktari noton nebo kanyoisetab kabwatutik anan ko psychiatrist eng Nairobi parental clinic. Yeah. And you do a lot of counseling on issues to do with even the depression thing.
Yes, I'm actually a consultant psychiatrist.
Yes.
And I also work in Madari Hospital. So I also deal with a lot of mental illnesses, also depression and other forms of mental illnesses.
Okay.
Yes.
You're in Nairobi?
In Nairobi. I'm based in Nairobi, yes.
Okay. As we continue with our topic today on postnatal depression, probably you can tell us about the blues. Could even fathers get those kind of blues?
Yeah. Yeah, there are cases where even the fathers get a mild form of dysphoria or unhappiness or a mild form of depression because some fathers are not prepared to the fact that when a baby comes, the mother will end up, or the wife in this case, will end up spending a lot of time with the baby. They might feel like they are abandoned in quotes, and some of them will even resort to drinking excessively, will become irritable. So it's also very good that even the fathers who are becoming fathers the first time, they also need to be prepared that, yes, when my wife delivers, I would expect some changes because the baby will be demanding. Again, also, we know that sexual intimacy immediately after delivery is not advised because the mother has to heal first. Some cases even up to 6 weeks. So they need to be psychologically prepared for that so that it doesn't come as a shock. And again, the fathers also need to know that this is their own baby. So they need to put all the support. This is their wife. They need to put all the support. They should not abandon them or feel abandoned. They should know that it's for a short time and everything will go back to normal when the baby finally grows up, and when the wife heals, everything will go back to normal. But there are cases where even the fathers will get mild depression as a result of the newborn. Yes, yes.
And the situation, you've talked about the sexual intimacy at that time. And probably there are situations where women go back to hospital in the first 3 weeks or that to be treated again. Probably they tear because of sexual abuse and all that. I don't know if that could be abuse or what, because she has to heal. But this guy is demanding. I don't know how to classify that.
Yes, I would say that is a form of abuse because, again, if this person is sick and the doctor has advised that she will need at least 6 weeks to heal, then it is right that you wait for the person to heal. So if now the husband is not able to wait for that, then now we would say it's a form of abuse because this is a real wound which needs to heal, and if it's disturbed, it won't heal.
It won't.
Yeah, but during the antenatal periods, the gynecologist or the doctor taking care of both of them. That's why it's good also for the fathers to attend clinics and discuss some of these issues, how they can actually deal with that energy.
Most
to
of
be
them
helped.
don't even do the procedure. even when we are pregnant for the first time, they probably, most of them, let's say, I cannot tell the percentages, but most men, most fathers do not go or accompany their wives for clinics, even the clinics, the first clinics before the baby.
Yeah, and that's what I'm saying. When you discuss with your doctor some of those issues, then you will be advised on how to deal with it. Because again, you know, we are saying now when the mother has to wait for the wound to heal for 6 weeks, what other ways can you help? I mean, can you use to deal with that sexual tension? So you'll be advised on some of those options because we know the only problem would be penetrating on the wound which is healing. So you will discuss with your doctor and you could be advised on other ways to deal with that tension. Yes.
So that you keep the man. Because many ladies think that keeping the man is okay, it is keeping the man, and probably some give in because they feel like probably he's going to run away from them. And doctor, just before we finish, probably you can advise, you can list some symptoms, the very severe symptoms that we need to watch out for. So you have even discussed in the earlier.
Yeah, when a mother delivers, the people are helping her around, including the husband, they need to watch out for any changes in the behavior because depression does not set in suddenly. it begins slowly. You see mild symptoms which keep worsening. So if you have known this person and for you've been married for some time, by the time the baby comes, you know the personality of this person. When you start seeing this person getting irritated easily, getting annoyed easily, they become withdrawn. They don't want to get out of the bedroom. They don't want to talk to people. Even people they liked their company, they don't want their company. Some will refuse to eat because they don't have appetite. They will lack sleep. They'll not be able to sleep. When you start seeing those changes, then you need to watch out. Of course, there are the severe ones which everybody will know, like when the mother starts hearing
Talking
things
alone.
which you can't hear, or seeing things which you can't see, or seeing what is wrong with this baby's face, and everybody can see the baby is normal.
good.
So those are obvious things. But before we reach through that severe case, you need to watch out for those simple symptoms, mild symptoms like irritability. And we know that most women are given a return date to the hospital after 6 weeks.
Yeah,
So you don't have to wait for those 6 weeks. If you see such changes, then you need to take them to the hospital. It's better to be sure than to be sorry.
Yeah.
It's better to go and ask and you're told this is normal, it will clear, than to wait until now it reaches the stage of depression or even psychosis.
You talked about visitors. Sometimes they can make the mother depressed because many visitors come at that time. And what do you advise visitors now?
No, I advise visitors, when you visit, first of all, these days their telephone number, I mean their mobile phones.
Yeah.
It would be good to find out whether, to call the mother and find out whether it's okay to come at that time. We are not trying to be westernized, but you know, sometimes the mother can be overwhelmed. Maybe this baby is sleeping during the day, and that's the time she wants to catch up with sleep. And then there are visitors. On the other hand, when the visitors come unexpected, because it can happen, and you need to sleep, tell the person who you're with, whether it's a house help or your husband, I need to rest, so if any visitor comes, please tell them not to wake me up, let me sleep, then they can wait. When I wake up, then I can be able to talk to them. Feel free to do that. And as a visitor, when you visit, don't expect this mother who has just delivered to cook for you or to serve
We are
you.
we are Africans. We
Yeah.
are used to eating all over.
Yeah. If there's nobody to help, then be the one to go and make the tea.
Yes.
Or to serve. It is you to find out what can I do for you. Can I hold the baby for you? Can I wash the utensils for you? Can I make tea? Not the other way around. Not for you to visit a mother who has just come from hospital after delivery and you expect them to cook. Yes, so I think we need to change that bit. The other option would be for even this new mother to know that such things will be expected and to have adequate help, somebody to help them around. Yes.
Probably there is a mother who's watching us, and probably the baby is not well formed. What do you call deformed? And probably has some problem happen. Kiasi. What do you advise those kind of mothers? Because I know the depression they are going through could be high.
Yeah, it is true that some babies might be born with some deformities. And it is good when you notice anything, even before you leave hospital, to discuss with the doctor or the healthcare provider who was taking care of you. Even if you come home and you notice, because we know there are some conditions which will show on later. Like if somebody has a baby has a blockage in the digestive system, it might not show when you are still in hospital. You might come home with the baby and you feed them and they are vomiting. So when you see some of those things, it's good to go back and find out, is the baby okay? But we know that there are other children who are born with malformations, like the obvious cleft lip. There are babies who are born with
Cleft.
a cleft lip. The lip is broken or the palate is broken, which everybody can see.
Yeah.
It would be most pediatricians will advise that such obvious problems which can even affect the feeding of the baby be corrected before the baby leaves hospital. But sometimes these mothers could be in a place where they have to be referred to Kenyatta National Hospital, very far, or to Eldoret Referral Hospital, depending on where they are. So it would be good that when you see such a thing, don't panic. I always advise people to believe that they have enough strength. God has given them enough strength to deal with everything which God presents to them. So if God has given you a baby who is malformed, then you need to believe that he will give you enough strength to deal with it. We can be able to deal with most of these situations. Because when you adapt a situation where you feel that I'm helpless, I can't be able to deal with it, then depression sets in. But when you are confident that, yes, even if there's a problem, I can deal with it, and I'll find people who can help me, whether they are doctors or nurses who can help me, then you can be able to deal with it. It's everybody would choose to have a normal baby, but we know that there are some babies who will be born with difficulties. So it's good to accept and discuss with the doctor what can be done about it, what options can be done, and be ready to support the child, and for the father also. You know, in our setup, there are fathers who will even abandon the woman, forgetting that this baby has genes from both of you. They say hii ni ya kwenu, hii ni ya kutoka kwenu. Kwetu hakuna watu kama hawa. And yet most of these conditions are genetic. They could be from either parent, and it's still your baby anyway. So even fathers need to support the mother, because I know most of the time the mothers feel that they are going to be abandoned by the husband, and even maybe the in-laws will disapprove of them. So when they are given support, then this baby can be nurtured, and now we are able to deal with most of those disabilities, and the children can live a normal life.
Loss of a baby is something very sad. We need to talk about again. When a mother when a mother loses a baby in hospital, or probably weeks later after the delivery, it comes so ash on her, especially when she's a first-time mother.
It's true, the loss of a baby can be very devastating to both parents, both the mother and the father. And when a mother loses a baby, they go through certain stages of mourning. Initially, they will deny. And I've seen, there's a time I was called recently to go and review a mother whose baby had died immediately after birth, and she kept saying, you have refused to, mmekataa kupea mtoto maziwa, mmekataa kupea mtoto maziwa, and she has been shown the baby has died. So she could not believe that the baby is dead. And it took her a whole day for her to accept. We had to put her on medicine because she was very disturbed, rolling all over, and saying we are refusing to give the baby milk, yet the baby had died. So when immediately a mother is told your baby is dead, the immediate reaction is to deny. And that denial can be so severe such that they become like confused and psychotic. They will do things which you will next expect them to do. But others, after that, now they move to bargaining, where now the mother starts telling God or praying and say, God, if you give me a chance when my baby is alive, if my baby doesn't die, I'll be good. They're bargaining and such. Then now there is the stage of anger, where you feel angry with the nurses. If it were not for you, my baby would not have died. Even when delivery, if you had taken good care of me, my baby will not have died. Even the antenatal care, if you had given me antenatal care. So you are angry with the nurses or the doctors, you're angry with your husband, probably you feel they didn't, if they were there, things would not have gone wrong if they had taken you to hospital. So the stage of anger, then finally acceptance. So when a mother loses a baby, you need to allow them to go through those stages. Some people will not necessarily go to the extremes in those stages. So even when you are saying denial, not everybody will deny to that extent. Some will accept within minutes, others within 1 hour. Some, it might even take a whole month. They don't mourn, and all of a sudden...
Others don't cry?
Yeah, they don't cry. All of a sudden, you start seeing the mourning process taking over all over again. So when you are near this mother who has lost her baby, and they are blaming you, don't be annoyed with them. It's part of the reaction, the natural reaction.
So it will go
after
just
the mourning process. Know that it is normal to be angry with the people around you, and it will clear with time.
Thank you.
They will come back to their senses, and they'll understand that it's not people who didn't do their things right.
It's nature.
It's nature, yeah.
Thank you, Dr. And probably final word before we close our program today.
Yeah, I would tell everybody to give a lot of support to mothers who have delivered a newborn. Watch out. If they need help, give them help. If they need support, give them support, and especially the husband, because you know visitors will come and go.
Yeah.
A house help might not even understand your wife. So the husband, you understand your wife, this is your baby, give them a lot of support and watch out for some of these changes in behavior. If you see that it is becoming too much, then you need to take them for assessment to see whether they need treatment or not.
Okay.
Yes.
Thank you so much, Doctor, for having your time today.
Thank
You've
you
really
very
shared
much
a lot.
for inviting me.
Thank you. Chitab kolenjin kai kashike koskolangutab raini kotab legityo ile bo kamanut missing ikuye chepyoseng'ung, kametab lagokuk anan ko kametab lakwet anan ko tamanet immediately kakosich lakwet asibet ikuye ak inai ile nee neimei si konyor inendet kanyoiset neyamat. Ako kakomwochi inendet kora kole miten kit nekile blues normal cho eng karibu kwonyik 50% kebertab 50 eng bokol ko normal cho. Ako bo kamanut missing ibai irib ak iboisiechi biikab kong'ung. Ako eng tetutienyo neuni nebo kotab legityo kainenyu ko Daisy Rotino ako kabaibai eng betutab raini kemiten ak Dr. Catherine Mutisya ne inendet koboisie anan ko psychiatrist eng Nairobi Parental Clinic Sirenyawo.